Open enrollment for Medicare Part D begins November 15th. To help you choose which plan is right for you, Retirement Living TV has created Spotlight on Medicare Part D, a complimentary DVD filled with valuable information. To order your free DVD, visit our website at www.rl.tv or call us at 1-800-RLIVING. That's 1-800-754-8464 and get enlightened before you enroll. Medicare introduced a major change in 2006 by adding coverage for prescription drugs. It's called Medicare Part D. With more than 40 million seniors eligible, it's had a significant impact on the lives of many people. But like most healthcare plans, it can be confusing at times, with too many choices and answers hard to come by. That's why we at Retirement Living TV created this DVD. Our shows, including The Voice, The Daily Apple, The Prudent Advisor, and Healthline, have put together special presentations about Medicare Part D to provide you with accurate and timely information. These programs will air the week of open enrollment, which begins November 15th. We've taken the best of those presentations and created this DVD because the more you know about Medicare Part D, the better you'll be at picking the right plan.
I'm Alexis Abramson.
And I'm John Palmer. Welcome to Spotlight on Medicare Part D. If you're an American 65 or over, Medicare is a part of your life. And while Medicare can be beneficial, dealing with the process is often difficult.
There can be a lot of questions, such as how do I know if I'm eligible? How much does it cost? What are my options? What is the donut hole? And how do I know what plan is right for me?
Over the course of this DVD, we hope to provide you with answers to those questions and much more. We'll start at the very beginning.
The Harry S. Truman Library at Independence, Missouri is the scene of an historic event. President and Mrs. Johnson and Vice President Humphrey arrive for ceremonies that will make the Medicare bill a part of Social Security coverage. Mr. Johnson chose to sign the bill here as a tribute to former President Truman. The former president campaigned for Medicare 20 years ago, but it took 2 decades for his proposal to become law. The new bill expands the 30-year-old Social Security program to provide hospital care, nursing home care, home nursing service, and outpatient treatment for those over 65. Medicare will become law on July 1st, 1966. And for Mr. Truman, an historic souvenir from the president.
Today, Medicare has different parts, starting with Part A, which is hospitalization coverage. Most people do not have to pay for this, but you still have to sign up for it. Part B is medical insurance for things like doctor's visits and outpatient care. For this, you will pay a monthly premium. Part D is for prescription drug coverage. This also carries a monthly premium.
And whatever happened to Part C?
Well, Part C is also called Medicare Advantage plans. They give seniors the option of receiving their Medicare benefits through private health insurance plans, such as HMOs, PPOs, and fee-for-service plans.
Choosing the Medicare drug coverage plan that's right for you begins with doing your homework. Earlier this week, my co-host, Alexis, explored that very topic on her show, The Daily Apple.
With me to help us understand some of the twists and turns of Medicare Part D is Amy Larrick. Ms. Larrick is lead trainer for the National Medicare Training Program at the Centers for Medicare and Medicaid Services, or CMS, in Baltimore, Maryland. Also joining us is Patricia Smith, who is Vice President for Regulatory Affairs at America's Health Insurance Plans, known as AHIP. Welcome to you both. Thanks for being here today. Amy, I know this is a tough, long question, but could you explain Medicare Part D for us?
Sure. Well, basically, Medicare Part D is Medicare prescription drug coverage. It started January 1st, 2006, which was the first time that Medicare has really provided comprehensive drug coverage. So it was exciting because most people who signed up for a prescription drug plan this year can save about 50% of their drug costs. So as we're looking towards 2007, we're talking to people about choosing their plan that they want to have for 2007.
Tricia, who is actually eligible for Medicare Part D?
Anyone who is eligible for Medicare. So if you have met the requirements for the Medicare program, you are also eligible to purchase a Medicare Part D plan.
When can a senior first sign up for Medicare Part D?
At the point that they are eligible for Medicare. So at the point they turn 65, or for people on prescription drug coverage, if they signed up last year, then as you said, they should be looking at what their choices are for the coming year. If they didn't sign up last year and were eligible, they should, because of the penalty that they may be looking at, they should seriously consider, and probably it would be a smart move for them to join up.
Let's talk a little bit about that penalty, because it is a fairly intense penalty. Why is it so intense?
Congress put it in place because if an individual doesn't, it's an insurance principle, if an individual doesn't sign up for prescription drug coverage when they're first eligible for Medicare, in effect they're staying out of the program until they need it. And so if at that point they enter and the program gets to be more and more expensive. Insurance works in Medicare or elsewhere because you get lots of people in the group, and that group then helps, if you're healthy, you help people who are sick, and then when you get sicker, then those costs all come together to help pay for you.
So this is actually, just to reiterate, 1% per month, they're penalized 1% per month, and that never goes away through the duration of your coverage, right. Correct?
That's right.
Now, we talked a little bit about creditable coverage. Creditable coverage. What is that?
Creditable coverage is an affirmation that your employer-based insurance that you may have in retirement, so let's say you worked for an employer, that employer gives you retiree health insurance, and in that is prescription drug coverage. Creditable coverage is basically a statement that says your retiree coverage from your previous employer is equal to what is available in Medicare. And if that's the case, then that employer will send you a letter that says that you have creditable coverage. And so for those beneficiaries, they should be in touch with their employer and make sure that that's the kind of coverage they want to continue to have. They still have the option of going into the standard Medicare program. But for most people, creditable coverage through their employer is going to be the smart thing to do.
Amy, what tips do you have for people who need some help to lower the expenses of their prescription drugs?
Well, the first tip would be to look into signing up for Medicare prescription drug plan if they haven't already. That'd be the best way. Like I said, most people can save about 50% on their cost of their drugs. Another thing they can do is consider talking to their doctor about switching to generic medications. A lot of the plans actually offer lower copays for generics. Some actually have no copays for generics.
But talking about that, what if a person's drugs are actually not on the Medicare plans?
If the person is on a prescription that's not on their Medicare plan, there's a couple things they can do. The first thing they can do is actually talk to their doctor and see if their doctor would put them on a drug that's on the Medicare plan, because all the plans are required to cover at least 2 drugs in every category. So no matter what, there's going to be a drug on there that could treat their condition. If they talk to their doctor and their doctor says it's medically necessary that they have to be on that medication that they're on, then the doctor can actually work with the plan and ask for an exception so the plan will cover that drug for them.
Okay, great. We'll be back in just one moment.